Greetings, everyone. My name is Dr. Hamia Adil, and I am here with yet another exciting video. For millennia, people regarded breathing as synonymous with life. Life begins and ends with breathing. The most important organ in our body that helps in breathing are pair of spongy fluid-filled cavities known as lungs. The lungs is the part of respiratory system consist of conducting airways, blood vessels, gases exchange units with alveolar gas spaces, and capillaries. The neural control of respiratory system includes the brain cortex, medulla, spinal cord, and the peripheral nerves that innervate the skeletal muscles of respiration, airways, and vessels. The lung is divided into two tracts, the upper respiratory tract and the lower respiratory tract. The upper respiratory tract includes nose, pharynx, and your larynx, whereas the lower respiratory tract starts at trachea. The left lung has two lobes, and the right lung has three lobes. Each lung lobe is made up of several wedge-shaped bronchopulmonary segments, which is supplied by their own segmental bronchus artery and vein that helps in the gases exchange. The lungs are covered by a thin membrane, which is called as visceral pleura, which is continuous with the parietal pleura that lines the inside surface of the thoracic cage. But when these bronchioles become inflamed, narrow, swollen, and produce extra mucus and makes it difficult for a person to breathe, then this is called as asthma, which is the topic of discussion. What is asthma? Asthma is a chronic inflammatory disorder of the lung airways which is characterized by airflow obstruction, airway hyperresponsiveness, and inflamed bronchi. It is usually reversible, either spontaneously or with treatment. Clinical features or symptoms of asthma vary according to the severity of asthma, which is classified from mild to severe and either intermittent or persistent. Let's first discuss the mild symptoms. So, the asthma presents with the symptoms of cough, chest tightness, breathlessness, and the most important symptom of asthma is wheeze, which is a characteristic high-pitched whistling sound made while breathing. Listen it carefully. And that's how wheeze sounds on examination. What are the symptoms that are clinically seen in the severe attack of asthma? The respiratory rate is incredibly increased and there is use of accessory muscles of respiration, which are two, sternocleidomastoid and pectoralis major. There is also deviated trachea. Your respiratory rate is greater than 25 beats per minute. Pulse is greater than 110 beats per minute. And the peak expiratory rate, which is defined as the start of forced expiration after maximal inspiration, is less than 33%. These symptoms are characterized as the severe symptoms of asthma. That's all for the intro part. But if you want to know the epidemiology, etiology, pathology, investigations, management, complications, and the prognosis of asthma, then you must have to stay tuned to sqadia.com.